Dr. Jiang received her DTS degree from Peking University School of Stomatology in 1993 and the PhD degree in orthodontics from the same university in 1997. From 2001 to 2002, she worked as a visiting honor associate professor in the Dental College, Edinburgh University, UK. Dr. Jiang is currently a professor in the orthodontic department of Peking University School and Hospital of Stomatology, where she has been involved in orthodontic treatment, education, and research. She is the editorial member of the Chinese Journal of Stomatological Continuing Education and Chinese Journal of Orthodontics. Dr. Jiang is a committee member of the Pediatric Oral Group, Pediatric Branch of the Chinese Medical Association, and a member of the World Federation of Orthodontists. In her clinical practice, she specializes in comprehensive orthodontic treatment of malocclusions, early preventative treatment, and application of low-friction, low-force treatment techniques, such as self-ligating bracket system and pass system, and clear aligner treatment methods. Her research interests include 3D dental imaging technology and its applications, and exploring the clinical effectiveness of the orthodontic appliances. Please give a warm welcome.
Good afternoon. Thank you for inviting us here, and it's my great honor to give this lecture here. And I have to say, at the first, my English is not as good as the morning speaker. I'm a little bit nervous, but I will try my best to explain the topic this afternoon. Okay, so the topic is about how to reduce friction in 3D directions. So, what is friction? Friction is the force resisting the relative motion of solid surface of light layers and materials elements sliding against each other, just like this. Thank you. So the formulas of friction is coefficient times pressure. As we can see from this three set of GIFs. The first set, we can see if you increase the pressure, so the friction increased. And from the lower, this set, you can see if the rough surface increase the coefficient, so you get higher friction. And how about that set? Yeah. The areas of the contact don't influence friction. That's what we must remember. Only coefficient and pressure. And then we can think in our orthodontics treatment, what influence the coefficient and what will affect the pressure. Yeah. Let's think, where does frictional force exist in the orthodontic appliance system? It's true, we move the tooth, but how we move the tooth? We use the bracket and the wire. So the friction exists between the archware and the bracket slots. This shows the different tooth movement order, first order and second order. So why is friction so important for orthodontists? Because in every stage of orthodontics treatment, friction exists nearly, and the friction matters. That's why. And if we change in the frictional force, may affect the efficiency or the outcome and even the treatment experience of orthodontic therapy. What do we expect from friction in orthodontics treatment? Is friction our friends or enemy? We can think about it in this way. We think about aligning, leveling, dilatation, torque control, space closing, anchorage control, or intermaxillary relation. Do you need a higher friction or you need low friction, or as low as possible, or is the lowest friction is the best? If we think about this, we can see, generally speaking, in any situation where there is a relative movement between the orthodontics planes, lower frictional force is beneficial for the orthodontics treatment. But in some specific situation, we do need more tooth control, which sometimes means higher frictional force is better. So, how do we control the friction? We need to always remember the formulas and then think about how can we control or can we adjust it, the coefficient. Different materials, elements give different coefficient. We got TMA archware, we got night-tie archware, and stainless steel archware. And for the bracket slots, we have ceramic brackets, and we also have stainless steel brackets. Compare with TMA and the night-tie wire or ceramic brackets. The combination with stainless steel archware and the slots have the minimum coefficient, means the lowest friction force. And if we think about the pressure, what will influence the pressure? Because the archware need to put in the slots. So if we put a pressure to the archware, how? Use the ligature. So ligature will give the pressure and will increase the friction. It is the ligature wear that's causing the contact pressure. Tighter ligation, larger pressure, looser or no ligature, maybe no or less pressure. So we can think about in which situation we have no ligature or we don't need ligature. Just like this self-ligating brackets. I know from this morning you use the diamond brackets here also, right? So this is the diamond MX, and now we have diamond Q. Let's have a look of this demo, which conventional brackets. With conventional brackets, we need about 10 to 150 gram force to resist the friction and make the tooth move. And with this passive self-ligating brackets or brackets with very loose ligature, the friction between the archware and the bracket slots is very low, extremely low. So you can see the brackets can slide very smoothly. You don't need any force to push it. Why? Because self-ligating brackets has less contact pressure, so has less resistance, lower friction. Tooth movement can be faster with low friction self-ligating brackets. Like this. Let's have a look of this case. This is a non-extraction case with passive self-ligating brackets. It's very crowding. And I use the diamond brackets and non-extraction, and I put open coil steel here. And this 1 month, we get a space here, and 2 months is nearly aligned. 3 months, you can see the tooth move very faster. And this is another extraction case with passive self-ligating brackets. That's initial, and bonding is very cloudy. And 3 months, the crowding relieves. For 5 months, it's totally aligned. Why? Because it's passive self-ligating brackets with very low friction. Do we have other ways to reduce the friction? Yes, we have another type of low friction brackets, as you all know. That's MLF brackets. It's modified from the conventional twin brackets. We just cut two small pieces from outer wall of slots under the wings, and the ligature wire can then slide away from the arch wire, leaving arch wire free of normal pressure from ligature. Then the brackets can slide along the arch wire freely, just like the self-ligating brackets do. When we change the size of arch wire, you get more pressure and more tooth control. You can use thicker ligature, like that. You can use thicker ligatures or elastomer ring to increase control. When changing to rectangular wire, you will get the maximum control of tooth movement in 3 dimensionals. That's MLF brackets. So, how do we use MLF brackets and PASS system to control the friction in 3-dimensional? Let's think about it in different order. First order, second order, and third order. So what's the first order direction means? That means the tooth get labial or lingual movement. So the slot depth is the key point for friction. For the conventional brackets, we have for this conventional brackets, we have a ligature wire or elastic ligature ring. We get a conventional pressure and a friction force. But for the self-ligating brackets like this, the pressure generated for this kind of self-ligating brackets, when we use a smaller or when we use a round arch wire, the pressure is about 0. And if you increase the size of the arch wire or we use the rectangular wire, you do have some pressure, but it's very small. That means we have very small friction here. But for the active self-ligating brackets, different archware size will get different pressure. Here, small archware, no pressure. Larger archware, increase the pressure. Rectangular, larger archware, you get maybe pressure even larger than conventional brackets. Sometimes you'll get more friction, but most of the time for the active self-ligating brackets, the friction is lower than conventional brackets. For the MLF brackets in the first order direction, what's different? These brackets, the depth of the slot is increased, so the pressure is decreased, so the friction is reduced. In this situation, we can see MLF brackets is just like passive self-ligating brackets. But can we see the MLF brackets is just as the same as the self-ligating brackets? No, because these brackets we still have wire ligatures. So we can adjust it, the frictions by changing the archware or changing the ligature, the way we leg it. So we can have multi-level friction. But with the passive self-ligating brackets, we only have the chance to change the wire, but we don't need to use the ligation. So the level of the friction is not many. We can say it's a solo level friction. That's the difference. For the first order friction, we also need to think in before only one tooth beyond single brackets. That means if we want to align this arch, we want to move this tooth labially. Not only here we need a lower friction. This part we also need lower friction. We need lower friction, the whole arch, dental arch. So if you want to have a very efficiency tooth movement, you need the whole archware in a low friction situation. This is a crowding case. At the first, we use a round nine-tie wire like this, and this passive self-ligating brackets, a round wire. So you get a little bit crowding relief, but you can't get everything done. What can we do? We increase the size and the shape of the archware. We use a rectangular archware, and then you will get a very lining arch. For MLF brackets, what can we do? We use a smaller round nine-tie wire first. It's similar with the self-ligating brackets. And what's next? What's next to relieve the crowding? Which archware will you choose? A larger round archware or a rectangular wire? which one is better for MF brackets? Can anyone answer these questions? Yes, a larger round archware is better because it's still a brackets need a ligature. It's not a real self-ligating brackets. This is enough. We don't need more force or no more pressure. But what else can we do to reduce the first order friction to make the tooth movement efficiency? Let's have a look on a case example. For extraction crowding case, we would like canine to slide distally with low friction. So we can choose 0.2 lecture wear here. 0.2 lecture. We just tied the distal wing here. For larger deviation tools, we want larger clearance. So we choose thin lecture wear. The single wing ligating also increase interbrackets distance to reduce the stiffness of archware like this. But for medium rotation tools, can see which tooth is a medium rotation tooth? You can use 0.25 ligature, and for mild rotation, you can choose 0.3 ligatures. Which one? Yeah, that's medium. That's mild. So mild rotation, we use a higher size ligature, so you can always get the suitable archware deforms. With MLF, orthodontist can adjust it first order clearance for each tooth on the same archware. That's the best way to adjust it, the friction, to give the orthodontist more control power on friction. Another question is why sometimes we use the single wing ligating. Like this, we use the single wing ligating is to lower down the force archware give out. Let's think about how about the friction in the second order. Kusi from University of North Carolina studied the restriction condition of teeth movement in second order direction. Here we got a tube, and here we got a slot and a ligature and archware here. When we put the canine distally, what will happen to the archware and the relationship between the archware and the slots will changes. Kusi illustrates the relationship between sliding resistance and the wear slot angulation in second order direction with these features. It shows when wear slot angulation increase to a point that archware start elastic deformation like this. Classical friction increase a lot to become bending. This critical angle is called theta c. If wire slot angulation increase larger enough to make wire a plastic deformation, bending becomes notion, like this. Bending, notion. This angle is called the theta z. Sliding resistance increase much higher, so never let theta larger than theta z. Never do this. Kusi point out the optimal sliding happened around this point. Around this point. That is theta roughly equal to theta c. When theta less than theta c, although friction is lower, here, that friction is lower, is increased during the bending stage. But this point, if theta is lower than theta c, the friction is lower. But archware has no elastic deformation, meaning no correction force. So we believe theta should be a little bit larger than theta c. This here is better. For efficient tooth movement, in clinic, second order size of slots is fixed. Sometimes it's 018 or sometimes it's 022. Which slot size do you use here? Is 01, 022 here? 022 diamond brackets, right? Okay. So what makes self-ligating and conventional brackets different is mainly in first order direction, not in second order directions. When we look at the situation in first order direction like this, first order, this is second order, and this is first order direction. You will find that for sufficient teeth movement, you also need a small theta angulation. That means just a little bit larger than theta c. At this time, the arch will just start elastic deformation and the friction is not very high. That's good for the tooth movement. And how to control the friction in the second order direction? We already know if we increase the clearance of wire and the slots, and we can increase the theta c. For these two kind of brackets, what's the difference of these two brackets? This one is wider. So you have a narrow brackets and a wider brackets. And what's different? You get a larger theta c in single or narrow wings brackets. You get a smaller theta c in double wing or wider brackets. And this one, larger theta c, you have lower friction. That means narrow brackets is better for tooth movement because low friction. How about this? If you increase the size of the slots, increase the size, you get larger theta c and you get lower friction. So larger bracket slots is better. But each bracket system usually use one slot size from the anterior teeth to the posterior teeth, right? You get only one slot size for whole mouth, usually. And we don't usually change brackets in different slots in the middle of the treatment just to change the friction, just to change the slot archware clearance. So that's why we not usually adjusted the slot of the brackets. What can we do to change this? We can increase the size of the archware, or we can use a small size archware to adjust it the clearance and to adjust it the theta C, to adjust it the friction. That's the way. And someone may notice the width of the brackets are quite different. We got wider brackets, we got narrow brackets. They are quite different. Demon brackets is quite narrow. It's not the narrowest, but it's very narrow. That's better for tooth movement. Here, this is the resistance to sliding. And this is the size of the archware. That's 19 archware in 18 archware in 18 brackets. 18 brackets, but the archware is 60. There's 22 brackets and a smaller archware. So the different combination, you get different clearance. Wider bracket slots and smaller archware, you get more clearance. Narrow archware, narrow bracket slots and larger archware, you get less clearance. Less clearance, you get more tooth control. But if you increase the clearance, you get less friction, more tooth movement free, but you get less control. So that's you need to balance. The brackets, after you bond it, is fixed. So you can just adjust it, the size of the archware to balance the control or balance the movement. And not only the size, also the shape, round archware or rectangular archware. I already gave the answer. For brackets with same width, how to adjust it, theta C in the second order, changing the archware, right? And we also need to see the second order friction beyond single brackets, beyond one brackets. Here, these tools need to lower down. Where the tooth position will affect the sliding friction. How about this tooth here? Or the angulation is like this. And the angulation between these two teeth is different. So the theta C is different. And the friction is also high friction, low friction here. If these tools move here, angulation change here. So you get higher friction. How about if tooth is here? Lower friction. But how? How can we do this? No, this just means we can adjust it the way we ligating the archware. Maybe we don't put this archware totally into the slots. We just tie a little bit, or we don't make this archware deformation a lot, just deformation a little bit. We can lower the friction. So the angle between the archware and the distal mesial end of the slot changes. The friction is changed also. The smaller the angle, the less bending we get. Smaller angle, less deformation, lighter orthodontic force, and lower friction, and more faster tooth movement, better for tooth health, right? Let's think about anything else that can affect the second order friction. Maybe brackets design. This brackets, a bracket like this, you have a cutter here. That will, you will get less archware deformation with this kind of brackets. Like this. Or maybe we can adjust it the way of ligation. We only ligature one wing, distal or mesial. You will change the angle between the archware and the brackets. And of course, we can change the size of the archware. The angle between the archware and the distal mesial edge of the slot change when we change the way we ligation. And next, we talk about how to control the frictions in the third order direction. Let's have a look of this patient. That's initial photos. Biomaxillary protrusion for 4 bicuspid teeth extracted. And that's the after. But what happened between the before and after? Before, he got a flaring incisor. And during the treatment, he's in a rush. He wants to go to abroad to study. So we have to pull the tooth back very faster. And that's we lose the anterior tooth torque. This, at this stage, the anterior teeth is quite straight. So what should we do? We use a loop and we put a torque here. And as you all see, the ending is okay, it's quite good. So what we talk about when we talk about the third order friction, basically we are talking the torque expression, because friction is a necessary condition for torque express. If you don't have friction, If you don't have friction, it's like this. You don't have torque expressed. So, just as I mentioned at the beginning, we don't always need a low friction. Sometimes we do need increased friction, like this situation. What we talk about, what the torque expression means. First, we need to have the third order clearance angle. And we need to know the slot and the size of the rectangular wire, and the materials of the slot and arch wire, and the torque friction and the resistance of slide. That's all we should think about when we talk about the torque expression. If the third order clearance angle is too high, torque will not express well. So that means a full-size arch wire is better for torque expression? Nearly. When we increase the rectangular wire arch, the size, we get less clearance angle, and we have a better torque expression. But a full-size arch wire is quite hard to put in the arch slot. What's the reason? So we do need some clearance angle. What's the reason for clearance angle? First, it's easy to insert the arch wire, and it's also very important. And the second, you get less pressure to the slot walls. That means you get less friction. Third, you can keep the torque control, but not resist the sliding of the arch wire at the same time. So that's why full-size arch wire is not always the good way. The better way is you have some torque clearance, and you also have enough torque expression, and you also have less friction to let the teeth sliding. How? Profit says, sitting the arch wire fully against the base of the bracket slots increase friction and is not advised in sliding mechanics. He also said, fully sitting the arch wire only when you do not want sliding mechanics. So factors that affect clearance angle is the combination of slot and arch wire and the materials of the arch wire and the slots. For stainless steel arch wire, every 0.001 inch less, you lose about 4 degree torque. But with different materials, if it is a night-high rectangular wire, every this inch less, you get more torque loss. So for same size, the stainless steel and the night-high arch wire has larger clearance angle because of they have a round blunt edge. So what's the difference in setting different brackets? This is active self-ligating brackets. That's passive self-ligating brackets. That's conventional brackets. So the arch wire setting are quite different. With this one, when you put the arch wire into the slots, you make the slide covered. So you got a fully setting archware. And that means a fully expression of the talk. And here, this is not true. Actually, with this relationship of the clip and the archware, this archware will not sit like this. It will have more clearance between the archware and the slot wall. And here, maybe we need to use the stainless steel ligator to ligation very tight to express the archware, to express the talk. Just like this, if it's a conventional brackets, sometimes rectangular wire with a talk, it's hard to fully engage. It's hard to fully engage. So you get half setting archware, so you don't have total fully torque express. If you put the archware inside totally, and you with a passive self-ligating brackets, so you get fully setting archware, you get fully torque express. Half setting archware, you get increased clearance angle. Distance of the couple decreased, so you get less torque express. The other way is you get more torque express. That's why I disagree that some people say passive self-ligating brackets are not good for the torque express. I don't agree, because we can fully express the torque. Just how you choose the brackets. You can choose high torque brackets and how you choose the size of the archware. So for extracting 4 bicuspid case with diamond brackets for the upper arch, so I always use larger size rectangular wire, maybe 19 plus 25 arch wire. But for the lower teeth, we don't need much torque control. Lower anterior teeth, we don't need much torque control. We want to lower teeth move back, move straight. We can use a smaller size arch wire, maybe 17 plus 25, or even sometimes 16 plus 25. That's how we control the third order torque. We changing the arch wire. For the torque friction and the resistance of torque, we can have a look of this this experiment. It's about third order torque and self-ligating orthodontic brackets tap effects on sliding friction. Let's jump to the results. The results shows that when we increase the torque, produce significant increase in frictional resistance with all set of brackets. But at 0 and minor plus 5 degree of torque, between 5 degree, minor 5 degree or you get generally less friction was created within the passive, then within the active self-ligating bracket cells. And the conventional bracket cells with elastomeric ligating generate the most friction. So conventional brackets generate the most friction. But with 10-degree torque, apparently with wire slot clearance eliminated, all brackets and tube set displayed similar resistance. And with the 15-degree torque, one passive set and one active set produce significant larger frictional resistance than the other three sets. What that means? We better don't have torque when we want to slide. Zero torque has less friction. But if we do need to give some torque, don't give high torque, don't higher than 50 degree. Maybe torque within 10 degree is better. You can have what you need torque express, and you don't have very high friction. That's the conclusion. So it's the third order torque in posterior dental segments can generate frictional resistance during anterior retraction with the archware sliding back. With small torque angle, friction is less with passive than with active self-ligating brackets and conventional brackets. Frictional force are substantial regardless of ligating if the wire slot's torque exceed the third order clearance. Bracket design is a factor also. So summary. Factors that affect the third order friction. What's the factor? First is torque angle on the archware influence. Second, the third order clearance angle of the wire slots combination. You got different combination. So please think about for the conventional brackets, for the self-ligating brackets, and for the MLF brackets, which combination is better for the third order friction control? Do you know the MLF brackets is very special in this aspect? Have Dr. Su Hong introduced the last time? Because most of the brackets we use, they have only one slot size. But PASS brackets, PASS system, we have different slot size. For the anterior teeth, the slot width of incisor is 020. It's not 022. For posterior teeth is 022. For anterior teeth, for incisor is 020. Why? So in PASS system, Professor Xu, that's what he think to do this, is to decrease the slot size for the anterior teeth torque control. And also will not increase the friction in the posterior teeth. That we can retraction the anterior teeth better, with better anterior teeth torque control and with less friction, so we get better outcome. Usually, when we do the space closing in PASS, we use 18 times 25 or even 17 times 25 standing still archware. And the tube and slot of the posterities is 0.22 inch. So less friction in posterities during the anterior retraction with the sliding mechanics. You can see the different combination. You get different clearance angle. Summary is because MRF brackets has different time wings, we increase the clearance, so decrease the friction. Friction of MRF brackets are lower than conventional brackets under all sorts of wire slots combination. Of course, PASS has different wire sequence, and you will know more the next day. Tomorrow you will know more about this. Can you see what's the shape of the archware here? A round archware here. So sometimes we use round archware to close the space. It's also to adjust it, the friction, adjust it, the torque control. Questions after class. It's a big question. How do MRF and the PASS manage the friction control in three dimensions during the whole orthodontic treatment? It's too big to answer, right? Okay. Thank you. Thank you. So, should we have a 10 minutes break or any questions? And then after that, we do this. Okay.
Okay, thank you, Dr. Jiang, for such a wonderful lecture. So now, if anyone has any questions, we have a few minutes to spare. But if not, again, we have a Q&A session in the afternoon as well. So right now, I think we can take a 10 minutes break, and then we can come back to the hands-on session.